So in the last episode, we talked a bunch about injuries in training, pain in training, the difference between muscle soreness and joint aches and actual injuries, acute injuries, chronic injuries, all the good stuff, all the nicks and nags that come with lifting heavy barbells and doing a bunch of butterfly pull-ups. And this time we want to start to talk more about the relationship between technique and injury, technique and pain, and then maybe some stuff about some tissue damage as well, since for a lot of folks, the actual relationship between technique and injury is less tightly coupled than they think, right? Meaning that it's not always as simple as, oh, you had bad technique, therefore you got hurt. Similarly, it's not always as simple as, oh, your elbow hurts, therefore you have this specific diagnosable issue with your tendon, or your knee hurts. That means that there's, something that's going to show up on an MRI that's going to explain why your knee hurts, or vice versa. Something shows up on your MRI doesn't necessarily mean that your knee hurts. So we want to kind of explain some of the relationships between technique, injury, tissue damage, pain, and hopefully give folks a useful way to think about that helps in training and in coaching, right? Because having a better framework for how to think about this stuff can help give more effective prescriptions for how people should think about making themselves more resilient and how people should think about potentially training through or working around injuries. So Jon, what do you see with your athletes who you coach, right? Either in the group classes or some of the more serious advanced competitors who you're working with, as far as technique and injury? What's the relationship there?
I mean, I think it's, that differentiation between different levels is important here. Someone that's brand new coming into the gym, a lot of the time they're actually, because they're so hesitant anyway, they're unlikely to hurt themselves because they're not going at a hard enough intensity or putting enough load on the bar or whatever it is. And I think, normally we see people that their technique will get to about, 80 to 90% like perfect within the first 2 to 3 months of training. So there's kind of a fast ramp up in terms of how good their technique is. And then after that, the kind of gradual increases in improving start to slow down a little bit, much in the same way as people see improvements in their strength or in their conditioning from training. They see a lot of progress early on and then it starts to taper. And I think we see that with technique as well. But I think for a lot of people, once they get to that 80 to 90% of perfection in terms of a movement pattern, the risk of injury is down pretty dramatically. I think you'll hit a point where just doing a set of 5 back squats with, let's say your knees dip in slightly, that alone isn't going to be enough to really cause a serious injury unless you're going heavier than you're capable of. And I think for most people who are newer or have less training experience, their risk of injury is relatively low as long as they're being smart and as long as they're not trying to do stuff they can't or trying to move weight they can't or go at an intensity that they're not comfortable with. So definitely those people with less training experience, if they're smart, injury risk is lower. I think for the higher level competitors, that risk of injury increases as soon as you start doing things at higher intensity or under more fatigue or at a higher volume. You increase that risk of injury pretty greatly.
Yeah, I think that the differentiation between people who are newer, people who are kind of just like learning technique for the first time, and then more advanced competitors is really, really important. And I mean, we harp on this all the time in a lot of our different podcasts, in different contexts and different scenarios, but especially with injury, sort of like you're saying, right? I mean, if I just speak anecdotally about our group class members at South Loop Strength and Conditioning, people who are getting started, going through the Elements program, getting started with personal training, all that stuff. A lot of these folks, like you mentioned, are very self-limited in what they can do because they don't have the technique, they're not comfortable with the movement, and they're not super comfortable pushing themselves, right? So if we think about the ability to create tissue damage as, I think we talked about this last time, right? Stressing the tissue more than that tissue can tolerate, you think about that in terms of the amount of loading on the tissue, either from an intensity perspective, meaning like the literal weight lifted, like as a percentage of their max or as a percentage of the tolerance of that tissue, or in terms of volume, like repeated stress on that tissue, they're going to have a hard time stressing their tissue enough to create injury because they just stop well before they get to that point, right? Their technique fails, right? I mean, anyone who's taught people to clean or press or anything like that sees that for beginners, right? Where it's like, okay, looks pretty good, looks pretty good, looks pretty good, looks insane, and you immediately can't do it, right? There's like no real ramping up in difficulty. They can't really grind reps out. They can't really, push themselves too far because they just suddenly can't do it anymore. So it's actually pretty difficult for them to cross that threshold of stressing their tissue more than that tissue can tolerate because they're just self-limited, right? Similarly on conditioning workouts, like you mentioned, John, right? For the competitors, a lot of what they're doing, given the demands of the sport, is figuring out like, all right, how do I hit, a legit 3-rep max front squat after I, did 100 weighted lunges? And you're like, oh, that sounds like that might hurt your hip flexor. And you're like, yeah, it might. But guess what? Like, it's going to potentially show up in some stupid qualifier workout for something. So you just have to figure out how to do it. Whereas if you tried to have someone do that who's brand new, a lot of times they're just flat out not going to be able to do it. They're like, I'm really tired now. Like, can I go get a drink? And you're like, yeah, for sure. Definitely.
I think there's a level of self-preservation there where the longer you train, the lower that feeling of self-preservation gets. So a newer person might be doing that workout and be like, oh yeah, my legs are really sore. I need to rest for a bit. Whereas like highly trained or competitive athlete might be, okay, I can push through this.
Yeah.
I mean, you take some, like you were talking there about, snatches being kind of self-limiting for a newer athlete. And there's only a certain amount of weight you can move because the technique takes longer to kind of perfect. And you take like Brooke Wells at the games, like obviously very well-trained athlete, very strong. Did she dislocate her elbow? I forget what the...
Yeah, I think she dislocated her elbow and potentially tore some of the ligaments or maybe even a tendon attached to it as well.
Right. You take that kind of situation, it's like, okay, well, you'd already done a bunch of heavier snatches. You'd been fatigued from all the work you'd done previously in the weekend, and that's likely what led to injury. It's not the kind of situation that a newer athlete or a less trained athlete is going to put themselves in. They're going to stop before they get to that point. And I think that's why, at least for me, I tend to see more injuries in the higher level athletes in comparison to newer or lower level athletes.
Yeah. And like we talked about in some of the podcasts we've done on, fatigue and pacing and training and all that stuff, right? I mean, a lot of the training process is essentially teaching your body and your brain that it's okay to kind of ignore the pain signals or the discomfort signals or the, whatever spike in some sort of metabolic waste isn't like a catastrophic event that needs to result in you like laying down for a while, right? That the training process in and of itself is a callousing of that fatigue response so that you can continue to just keep doing stuff, even though your body is giving you signals that like, hey, this is like becoming difficult and maybe we should rest a little bit. And as athletes become more advanced, they ideally are more dialed into those signals and can react to them appropriately, but also they can push through them, right? They can override that signal and be like, yeah, you know what? This is very uncomfortable, but I like winning a lot more. So we're just going to keep going.
And one thing to think about, I guess, is the fact that when someone is well-trained, they can normally get away with worse technique on things, for the most part. And I don't think that necessarily the technique for the higher level athletes who do get injured is the issue, right? It's more so the under fatigue, able to control the body, able to stabilize when you've got so many fatigue factors kicking in. You look at someone who's doing a 1-rep max clean and jerk at the CrossFit Games. It's normally doesn't look great. If it's a true max, it normally doesn't look that good, and their technique isn't perfect. But they're so well trained that they can get away with it and they can still get the weight up. I think it's then if you were to have like a 90% clean and jerk under extreme fatigue is where you have that higher risk of injury. And it's not necessarily the technique that is causing the injury. It's more so the muscle fatigue or whatever other fatigue factors are kicking in.
Yeah, for sure. Well, and I think there's also a relationship between fatigue and technique as well, right? I mean, if we think about, I mean, again, we're just going to keep saying this over and over again in this series here, right? It's like, okay, are you exceeding the tissue's tolerance to handle whatever load you're putting on it? And situations in which you might do that, right? Like, could be a position of, less mechanical advantage. You mentioned the knees collapsing in, right? I mean, you can make an anatomical argument that a certain amount of that sort of like rotation in a squat is actually okay. And I definitely buy into that. But clearly there is a point where, okay, something is going wrong with the hip's ability to stabilize the lower extremity, and you're developing this compensatory pattern to get through the range of motion that you want to get through, because you're just basically finding a point of stability that isn't relying on your hip musculature, but is instead just sort of relying on your connective tissue, right? And if you do that too much, you're potentially going to stress that connective tissue more than it can handle, and you may run into a problem. And what are scenarios in which you may have to rely on your connective tissue to stabilize you to get through a range of motion? Like you mentioned, John, it's when you're under extreme fatigue. And why might that happen? Well, as you fatigue different motor units, right, they sort of go offline, right? So I think we talked about this in one of the episodes of a CrossFit Games discussing like one of the sled events, right? Where people they're trying to push the sled and they're running and like, they're just like all floppy, right? They're like, whoa. And the reason that happens is because motor units that you would normally use to do that movement are so fatigued that you can't use them. And then you have to tap into other motor units to try to get the gross movement pattern done with less effective stabilization and not using the motor units that you're used to, right? So you end up doing weird stuff. So that's when you see, like you mentioned, these lifts under fatigue that look super sketchy, right? That's when we see the tendency to rely more on connective tissue and sort of like altered movement patterns to create stability and get through ranges of motion, rather than using the quote unquote ideal way of creating stability, whether that's, proper bracing to the core, whether that's proper activation of the hip musculature, whether that's to use like the DNS terminology, right? Keeping your joint centrated, which allows for optimal activation of all the supporting musculature surrounding a shoulder joint or a knee joint or a hip joint or whatever. And that in these positions that are outside of the normal range of what we do, where we've sort of fried all the motor units that normally stabilize that musculature, yeah, there is more of a tendency to potentially rely upon connective tissue or other motor units that are not used to this load to get us through that range of motion. And since we're doing that repeatedly, we may end up in a situation where we have exceeded that tissue's tolerance for stress, and then we can create tissue damage, right? And again, it's not necessarily one-to-one. You can see people who can get away with this forever, right? That they're never going to get hurt. Every rep that they do looks absolutely awful, and like they're just fine, and they're always going to be fine. And then you see someone else whose technique looks perfect, but they get hurt all the time. So it's not as simple as just like, oh yeah, your knee caved in, therefore X, Y, Z. It's like, yeah, guess what? Like this dude Dan, he comes to 5:30 class every day. His knee caves in like crazy every time he squats, and he's been doing this for 20 years. He's going to do it for 20 more, and he's never ever going to have a problem ever in his entire life. Like, Dan's lucky. It's okay. It happens sometimes.
Yeah, I mean, I think one of the things with injury as well is that recovery side of it. So coming back from an injury, like again, take Brooke Wells. I think she's always going to struggle with snatches from a mental standpoint. She can do all the rehab.
It's an aggressive statement.
It's
an aggressive statement, John.
I think it's hard not to,
Sure.
When you have an injury like that, it's always going to be in the back of your mind, and you can do all the rehab and you can do all the strengthening needed to get back to hitting those heavy weights, but it's hard to push that out of your mind. And especially with something like snatching, I think there's that air of hesitance when you're doing a heavy lift. Even if you're just going for a 1 rep max, because it's such a fast movement and there's such little time to think about it, there's definitely kind of a hesitation and a slight reserved feeling about it. And when you've got that injury playing in the back of your mind, I think that's something that's hard to kind of shake off. And, potentially puts you at higher risk of injury because you're not committing fully to doing it. And you're not following the same movement pattern that you normally would because you're like, oh, I need to protect it and things like that. So I think the mental aspect of coming back from that kind of injury does put you at a higher risk of injury as well.
Yeah, I mean, it can put you in like a weird no man's land, right? I mean, I think that I can think of personal experiences playing soccer with ankle sprains and knee sprains where it's like, okay, yeah, you have an injury and you go through the process of like, all right, it's inflamed for this amount of time. It actually kind of hurts for this amount of time. It's not really painful anymore, but it still feels weird for this amount of time. Okay, but for all intents and purposes, it seems like it's okay. But for the next year, I'm like kind of sketched out to really plant hard on that foot, even though it's really fine. And so you end up doing weird stuff to kind of avoid that, right? Like you end up doing like weird shuffle steps because you don't want to push off of your right foot in certain situations. And, I don't know if that's necessarily like, oh, that makes you more at risk of injury, but it's weird, right? It's like, oh yeah, like I did a really strange thing there because not because I'm like, oh, I should be careful of my right foot, but because some subconscious, like little calculator of like optimal motor patterns is like, we should like really not load that joint as much. So let's try to do it this way instead. Right. And like you mentioned, especially on a snatch, if you're going heavy, that can result in strange stuff. I mean, I had wrist surgery, 5 years ago at this point, and I definitely experienced that on snatches, that it all feels good until a certain weight. And all of a sudden my brain is like, we really don't want to catch a barbell in like full wrist extension. So you should do this really weird thing with your shoulder instead. That'll definitely be a good way to avoid that. And you're like, oh, that kind of bothered my shoulder. I didn't like that.
Yeah. I think that's something that's also less varied based on ability and experience. I think
what do you mean?
A newer or less trained athlete and a well-trained athlete have the same kind of thought process when it comes to hitting movements post-injury, or movements that they had been injured on, coming back into it. Like snatch is probably less so in the sense that a less trained athlete is going to struggle with the technique of it more so anyway. But even to say someone who's hurt their back, on a deadlift, a heavy deadlift, they've pulled something in their back, they had to take a month off. Regardless of your training experience and ability, I think that's always is kind of level playing field in terms of coming back and the mental approach to it and the concern and the hesitancy and all that kind of thing that goes along with it. I don't think elite athletes are different to less trained athletes in that situation.
Sure. No, I think that's an interesting point. Yeah, that it's especially because it's subconscious, right? It's not mental in the sense that like, oh, you didn't visualize this enough, or you're thinking about this thing. It's the little computer in your brain like guessing at whatever angle you need to push off at to accomplish a certain thing is like adjusting based upon something. And that's really, really difficult to change, right? That's not just like, oh yeah, it's like meditate and like do a morning journal and you'll fix it. No, not really.
I think
so John,
a little meditation would make everything better.
What's that?
A little meditation would probably fix the problem.
You think so? Morning
pages?
Yeah,
I might send Brooke Wells a message.
Yeah, morning pages, a 5 a.m. Morning routine. That'll get it.
Yeah.
That'll solve that problem for you. No problem. Easy.
Yeah.
So something else I wanted to start to talk about, right? I mean, we've been kind of circling around this idea of technique and injury and the relationship between good technique and, whether or not that actually prevents injury or can help people. So what is the role of improving technique in injury prevention, right? Where does that fall for, like we talked about, beginner-ish athletes, and then for the more elite athletes? How much time should they focus on technique, and how much is injury prevention like a legit thing that can come from that?
I mean, I think, obviously it's important to keep improving your technique. Regardless of the injury side of things, improving technique is going to help with efficiency, which is going to help with improved strength or conditioning or whatever it is the focus is on. But from an injury prevention standpoint, I think the time is better spent on the more focusing on stability and or mobility or stability and range of motion work, which is going to allow for you to better protect yourself when you're working under fatigue or when you're putting yourself in a situation where injury is more likely. And that, again, that's on the assumption that someone has mostly good technique. You know, using that kind of 80% of perfection guideline of if you're above that point, then yeah, working on technique is important. But from an injury prevention standpoint, I think it becomes less important and the improving joint stability is more important.
Sure. Yeah, I think that the way that I think about it is, you know, if our goal is primarily injury prevention, there's a lot of stuff that can be done. And especially if you're an elite athlete, it's like, yeah, maybe just do all of it, right? If you're training for however many hours per day, like check every single box, do every DNS exercise, do every PRI exercise, roll out at night while you're watching TV, you know, spend 30 minutes warming up on your technique, like just do it all for sure. If you get any improvement out of it, it's worth it, whatever. But for people who maybe don't have as much time to train, or for coaches who are trying to think about like, okay, what should we actually be prioritizing here? Kind of like you mentioned, I think that the most important variables are going to be improving tissue tolerance to stress, right? And a lot of that is just through like reasonable training, you know, progressing things in a way that makes sense over time, not jumping a ton in volume, not jumping a ton in intensity. If we are trying to do fatigue-based training, putting people in scenarios where they're progressing into that. And then sort of like you were saying before, John, just like giving people exposure to a lot of stuff where they're going to have to potentially touch on these things, you know, okay, like we do want you to be able to do a heavy clean and jerk after doing all these stupid weighted lunges and handstand push-ups. So how can we create scenarios where we're exposing you to that in a progressive way so that it's not like the first time you've done it? Because I think that a lot of issues come from people, again, like we said, over and over and over again, you know, putting themselves in a position where they're stressing themselves in a new way more than that tissue can potentially tolerate. So how do we build those scenarios into their training so they're at least exposed to it? And how do we do it in a progressive manner? And I think that matters more than just specifically working on whatever snatch technique drills or shoulder to overhead technique drills, because that's not going to be the primary thing that's going to cause them to be in a bad situation, I think.
Yeah, and that's something we do in our group classes at my gym is we have our 3 different tiers of training. We have health, fitness, and performance, which are all kind of focused on different things for different people. But on the strength side of things, we're able to have people doing health really focus on more of the basic movements that are going to help them improve their strength and improve their resilience, and allow those people who are more towards the higher end of the performance spectrum to be able to push themselves in movements that are more complex or under fatigue. So, you know, for Fridays in our current cycle, our health people are doing front squats, our fitness and performance are doing overhead squats. And, you know, a person who is relatively new to training or to strength training and someone who is not focused on trying to have any kind of competitive viewpoint in CrossFit or, you know, anything in that kind of range, they don't need to be doing heavy overhead squats. Yeah, there's a benefit to an overhead squat, don't get me wrong, but they're going to be much better served hitting a front squat, working on that positioning, you know, core bracing, leg strength, that kind of thing, as opposed to worrying about that shoulder stability and where is the bar overhead and all that kind of thing that goes along with it.
Yeah, and especially for newer people, and we didn't really talk about this as much, but I think that a lot of injury prevention stuff for them, like you mentioned, you know, from training, it comes from like, all right, let's expose you to these movement patterns. Let's get you some practice squatting. Let's get you some practice hinging. Let's get you some practice doing various pushing and pulling maneuvers. And then, just by improving the motor control and exposing themselves to those positions in relatively safe scenarios, they're going to see a lot of progress in terms of their fitness, and they're going to see a lot of progress in terms of their resilience. And I think the other big thing for a lot of those folks too is going to be just like general lifestyle stuff, right? That like, the state of someone who's like, cool, yeah, I mean, I basically work a desk job, I sleep badly, I'm on my phone all night, I have it next to me on my nightstand buzzing, sending me emails, I drink 5 nights a week, and I eat whatever catered lunch shows up in my office multiple times per week. It's like, okay, cool. Yeah, there's a lot of stuff that we can talk about with injury prevention and resilience. But if you're in a state of, chronic sleep deprivation, chronic inflammation, like eating a bunch of garbage food, and then like randomly going hard in the gym 3 to 5 days a week when you do show up, and then not showing up for 2 weeks sometimes, like, a lot of those other lifestyle factors are maybe going to be much more important than like, hey, cool, here's this like sweet foam rolling drill from Instagram. It's like, I don't think that's going to help if you're still doing all that other stuff.
Foam rolling fixes everything, Todd. You know that.
Yeah. I did recently try to find some wall mounted foam roller storage things, since we always just have like foam rollers all over the gym. I'm like, okay, we just got to admit that they're not going to go back where they belong. Like, let's get these wall mounted things everywhere. So people are just like, yeah, sweet. Here we go.
Are all the foam rollers the same size?
No, but close enough. It'll work. It'll be fine. Yeah, we'll figure it out. We'll figure it out. But yeah, I don't know. I mean, Jon, I think that we talked about a lot of stuff here in terms of the relationship between pain and tissue damage, and the relationship between technique and injury. And hopefully that's somewhat helpful. Again, for coaches, having a more detailed understanding of what is going on can be useful, even if you're not necessarily going to communicate all of this stuff to athletes, but just for back-end purposes of like, how do I answer this question? How do I design this program? How do I figure out what to focus on with someone? Having a slightly more detailed understanding is important. And for athletes, I think the tricky thing is just sort of decoupling this one-to-one relationship of like, oh, I got hurt, that means my technique was bad. Oh, I got hurt, that means that, I need to go get an MRI and figure out exactly what's going on. It's like, yeah, there is a relationship between these things, but it's much messier than we would think. Sometimes it's just bad luck. It's like, oh, why did this happen? Like, why did I strain my lat? Is it because I didn't do enough accessory work? Is it because I didn't, complete my full 25-minute mobility routine? It's like, you're just unlucky. Sometimes it just happens, and you didn't necessarily do anything wrong. And it's just part of the process. So I don't know, that I think that communicating that can be a little bit difficult, but it's hopefully important and helpful to get athletes to kind of understand the just like chaotic nature of training for sport. I don't know. What do you think?
Yeah, I think that's pretty accurate point in terms of, that injury avoidance, injury prevention, and best training practices for that. And I think people have to, it's something that gets talked about in CrossFit about how there's a high risk of injury in CrossFit and people are always hurting themselves. But it's worth remembering that there's always that risk when you're doing any kind of training, whether it's a sport, whether it's strength conditioning work. The risk of injury is always there. And it's kind of up to individuals to decide, do they want to push that bit harder in a session and potentially risk injury, or pull back a little bit and keep themselves safe? And I think that's different for everyone in terms of their current situation and their goals of their training and things like that. But ultimately, holding back slightly if you feel like you're in danger of hurting yourself is not that detrimental to your training.
Oh, for sure.
If you think going for that last snatch of the workout at the end of a 20-minute AMRAP is a risk, and you're like, I'm not feeling it, I'm not confident, it's, you're not losing a whole lot by not hitting that rep.
Yeah, that's a really good point, John. That the training stimulus doesn't come from that like final rep over the edge where it's like, okay, I have this percentage of whatever hit points left, and unless I've fully exhausted that by the end of my training session, I'm not going to get the maximal result from it. It's like, yeah, it doesn't actually work that way, right? You get the training result from the overall session, not from just like, okay, I really emptied the tank at the end. It's not where it comes from.